It is Breast Cancer Awareness Month, and experts want to get the message out to young women that they are not immune to breast cancer. We're joined by Dr. Christina Stevenson of Uconn Health, who is one of our 3 Cares partners. Thanks for being here.
Thanks for having me.
So tell us a little bit more about the importance of getting an early mammogram and the technology that provides some better imaging at Uconn Health.
Yeah, absolutely. So it's very important that women get their mammograms and get them regularly. At Uconn Health, we recommend that women start screening mammograms at age 40 and continue to do mammograms annually after that. We know that mammograms are the best way to detect a breast cancer in its earliest stages when it's easiest to treat. At Uconn Health, our mammography is done with what's called tomosynthesis or 3D mammography. That enables us to do a mammogram in about half the typical time, where the woman is in compression for the mammogram, and also half the dose of radiation. And we get a 3D image for the radiologist to look at.
Are you seeing patients that skipped their mammogram in 2019 and 2020 because of COVID? And if so, are they coming in with some issues now that are a little bit delayed?
Yeah, so we have seen a number of patients come in, unfortunately, with later stage diagnosis and citing the COVID-19 pandemic as why they delayed their mammogram in the last year or so. It seems to be hit or miss. I think we're a little bit lucky in Connecticut as far as having a higher vaccinated population and being able to get back to more normal things, that we have had patients come back in for regular screening. So in looking at our numbers at Uconn Health, we actually are screening just as many patients now as we were prior to the pandemic.
And that's good news, right? That's what you want to be doing, screening patients.
Absolutely.
If they do get that diagnosis, what are the next steps? What are the treatment options that are available for folks now?
So typically the treatment of breast cancer begins with surgery. Particularly when we have early stage breast cancer, we can start with surgery as the first line treatment. And that can be either a lumpectomy or a mastectomy, sometimes with a lymph node biopsy if needed, depending on the different type of cancer and what that patient needs. Sometimes we also need to add chemotherapy or radiation treatment into that as well. And so it's a really multidisciplinary combination of treatment. We examine each case individually to see what they really need.
And you have a high-risk breast cancer clinic at Uconn Health, which is kind of unique. Tell us a little bit about that and how it helps patients.
Yeah, so at Uconn Health, we recently started a high-risk breast clinic that looks at all sorts of different patients with genetic mutations. We have a wonderful team of genetic counselors, as well as some physicians that work with them to diagnose these patients that may be at higher risk, diagnose what genetic mutation they may have, see what type of advanced screening they may need, see if they would benefit from any risk reduction therapies such as medication and closer monitoring.
All right, Dr. Christina Stevenson with Uconn Health, thank you for your time. Some good information there. We appreciate it.
Thank you.